This chapter really focuses on essentially the bones of your skeletal system. So we're going to walk through all the bones. We'll walk through, in terms of your skeleton, we have over 200 bones. We kind of divide them up into the axial skeleton. And how I remember that is, I think, like axis, like the axis in your, like the axle, that's the word I'm looking for, the axle for the wheels of your car, right? Things rotate around it. And so I think axial skeleton, it's everything right in the middle. You can kind of rotate around it. So it is the skull, the vertebrae, and then we call it the bony thorax, which is basically the ribs and the sternum. It's just right in the middle. And then the appendicular skeleton is everything else. So it's the shoulders, the arms, the hips, the legs, okay? So we're going to walk through the skeleton, talk about all those bones. At the very end of this chapter, we will go over a couple of disorders that are associated with the skeleton and the formation of your bones, especially in an embryo. So the skeleton is mostly bones. Obviously, when you look at a skeleton, like I have back here, it's mostly bones, but there is some cartilage, right? So we have cartilage that connects the ribs to the sternum. We also have cartilage at the ends of all of our bones. We call that articular cartilage. We also have within our skeleton, we have joints. Now, we are going to talk about joints in the next chapter. So next week for chapter 8, we'll do joints. Joints are essential because they allow for movement, but they are the weakest part of our skeleton. Our skeleton would be much stronger if we were one bone from head to toe, right? But then we'd have no movement. There'd be no hinging. The other thing are ligaments. Ligaments are going to connect all of your bones together. So those are also essential. Now, your skeleton makes up about 20% of the mass of your body. And so, you've heard people say, he's just big boned. So I used to have a cat that was super fat. His name was Clyde. And my friends would joke about how fat he was. And I would always say, he's just big boned, right? So sometimes people will say, oh, they're just big boned, thinking your bones are bigger and they're making up more of your mass, right? That's not necessarily true. That doesn't actually happen. Bones are typically 20% of your body mass. Again, we divide our bones into axial and appendicular, and that's how we will go through them today. So this right here is showing you in blue, in this image, everything that's blue, you can see the axial skeleton. So this is everything right in the middle, right? It's the skull, it's the vertebrae, and then you can see we call this the bony thorax. So it's the ribs and the sternum. So we're going to go through the skull, then we'll do the vertebrae, then we'll do the bony thorax. Okay, so we would say the skull by far is the body's most complicated bony structure. In fact, in lab this week, if you look at that study list at the end of your PDF, you're going to see for the skull, you're going to see the most bones and bone markings for that. For any other bone, it's going to be the skull where you have the most. Your skull has tons of grooves and depressions and projections, allowing for muscles and blood vessels and nerves to pass through. So your skull is incredibly complex. So we actually say that your skull is divided into the cranial bones and the facial bones. So the cranial bones are all the bones that sort of surround where the brain sits. Okay, so they're going to protect the brain. They're also a site for a lot of head muscle attachment, right? So like the muscle right here that allows you to raise your eyebrows, it's connected to those cranial bones in the front. Now your facial bones are the ones right in front. These are going to supply the framework for your face. So they're giving your face a structure. They're also housing your sense organs like your eyes and your nose and your teeth and your mouth. They're providing openings like for air, for food, okay? And they also anchor a lot of your facial muscles for facial expression. So like smiling, right? That's all coming from those facial bones. So I'm going to walk you through your cranial bones and your facial bones. So we have 8 cranial bones. Now I will tell you that for your skull, almost every bone, with a few exceptions, is paired. You're going to find this throughout your entire body. If you do a cut, a mid-sagittal or a medial cut, remember this means right down the middle, what you're going to find is that you're going to have a bone on the right and a bone on the left, right? So in your face and throughout your body, your bones are paired. You have one on the right, one on the left. Your skull is no different. So in the cranium, you have, here, I'll show you a picture. I don't have a picture. All right. You have 2 parietal bones. They kind of sit on the sides. You have 2 temporal bones. These are right above your ears, like around your temple. One on the right, one on the left. Now you do have, for your cranial bones, you have some that are not paired. So your frontal bone is the one right in the front. It's your forehead. There's only one of those. I'll circle where the ones we only have one of. Your occipital bone is in the back. You only have one of those. And then you have your sphenoid and your ethmoid bone. So we just kind of went around the top here. The sphenoid and ethmoid bones sit on the inside. So if I were to kind of like cut my skull this way and lift the top of my skull off and look down at the floor of the cranial cavity, that's where you find the sphenoid and the ethmoid bone. Again, these are also not paired. Okay. Now for our facial bones, these are the ones up front. We have a mandible, which is basically your jaw. There's only one of those. And a vomer bone, which kind of sits in the nose. There's only one of those. All the rest of your facial bones are paired. So you have maxilla bones. These are like your bones in here. It's everything up above your top teeth and kind of comes up and around. That's all the maxilla bone. You have 2 zygomatic bones. Your zygomatic bones are sort of like your cheekbones. You do have 2 nasal bones. Your nasal bones are right in here. They make up sort of the bridge of your nose. Your lacrimal bones are in the, as you walk into your eyes, they're just in a little bit farther. You actually have little holes in your lacrimal bones called the lacrimal fossa. And these little holes are where your tear ducts are coming from, okay, and helping to drain. You have 2 palatine bones. These are actually in the roof of your mouth, and they're making up part of your hard palate on the top of your mouth. And then we have 2 inferior nasal conch, and these are folds that are inside the nose. Okay, so we do say, and notice at the bottom I have this starred, for your facial bones, the only bones that are not paired are the mandible and the vomer bones. That's it. All the others are paired. Now we also have, and I will go over pictures of these with you on Wednesday. So I'll go over where you can find all of these and talk more about these on Wednesday. Now inside of your skull bones, you also have open spaces called sinuses. These open spaces that are sort of within the bone, these are lined with mucus. They are filled with air, and basically the job is they help to lighten your skull. Anytime a bone is hollow, it is not nearly as dense. So they make your skull a little bit lighter. They also help to enhance the resonance of your voice. You know this because when you have too much mucus, right? If you're sick and you have an overproduction of mucus, it ends up clogging your sinuses. That's when your sinuses feel like there's pressure there. And I always think, you know, when I have a cold, where do I feel pressure? I feel it here, right? I'll feel it here. And sometimes like I'll feel it in my eyes. Like if you rub your eyes, it just feels like your eyes are going to pop out of your head. That is exactly where your sinuses are. So you have sinuses. You have a frontal sinus, which is right here. You have maxillary sinuses, which are right here. And then you also have, sometimes we call these your deep sinuses. Oops, I don't know why that connects every time. Your deep sinuses are in the orbitals. They're in your eye sockets. So those are the sphenoid and the ethmoid sinuses. And so here's a great picture of these. So you can see these from a frontal view, right? We can see our frontal sinuses in purple, the maxillary sinuses right here, and then the sphenoid and ethmoid sinuses. I know it kind of looks like they're on the sides of your nose, but they're not. They're actually deep in your eyes. So if we flip over and look at this from a lateral view, from a side view, now you can see those sphenoid and ethmoid sinuses, and you can see how deep in the orbitals they go. Okay. Now, another bone I want to mention, and we are going to look at this in lab on Wednesday when we do our Chapter 7 lab, is the hyoid bone. Now, the hyoid bone, I don't know if you can see behind me what I'm pointing out. I'll use my finger instead. So it is right below the skull, and it is sort of this U-shaped bone right below the skull. It's not actually part of the skull. This bone is pretty interesting. This is the only bone in the body that does not articulate directly with any other bone. That term articulate means it's just a joint. So basically, it's not forming a joint. The hyoid bone is actually held in place by muscle. And this is a bone that really helps to raise and lower your larynx when you're swallowing and when you're speaking. And so, you know, your Adam's apple right in here that guys have, and ladies, we have one too. Ours just isn't quite as big. The hyoid bone, when you swallow, you can feel that move, that larynx move, and your hyoid bone is helping that happen. Okay. So it's the only bone in the body that's not articulated with any bone. It's just held in place with some muscle. Now, this also happens to be the same bone where if they're doing an autopsy and this bone has been crushed or broken, then that person has been strangled, right? The only way that that bone can get crushed or broken is if you put enough pressure here. It's way up under the mandible. So you have to put enough pressure here where you're going to block the windpipe, you're going to block the trachea and cause a crushing of that bone. So if you ever watch like NCIS or Criminal Minds or I don't know, Law and Order, any of those shows, they may have talked about that before. All right, and some other bones that are in the axial skeleton are vertebrae, right? Those are in the back. We have 26 vertebrae, and vertebrae are considered irregular bones. We talked about that last week at the beginning of the week, chapter 6. And our vertebrae are divided into cervical, which are in the neck, thoracic, which are sort of in the middle, lumbar, which are the lower back, and then the sacrum, which is very low. Now, the number of vertebrae that you have for each of these, the way I remember is I think of the times of day that you eat. So you have 7 cervical vertebrae. You eat breakfast at 7. You have 12 thoracic vertebrae. You eat lunch at noon. And you have 5 lumbar vertebrae. You eat dinner at 5. Right? So that is for me a really easy way to remember the numbers of vertebrae. Now your sacrum is actually, it has about 5 vertebrae in it that are all fused together. So it looks a little different. So I'll show you that one. So we can see up here in blue, these are our 7 cervical vertebrae. Here in green, those are our 12 thoracic. Down here in purple, those are our 5 lumbar. Now, if you look in orange down here, those are the sacral vertebrae that have all fused together. So you can see they're not separate from each other. And then at the very bottom, you have a coccyx, which again is like 4 vertebrae fused together. It's much smaller. Sometimes we call this the tailbone, okay? Now, in terms of your vertebrae, okay, sorry, I wanted to make sure I didn't have that on another slide. In terms of your vertebrae, so we have certain numbers of each. We also give them names. Like, for example, our cervical vertebrae are called C1 through C7. So we can see that here. I have to move that over there. Okay. Our thoracic vertebrae are T1 through T12. lumbar vertebrae are L1 through L5. The way we give these sort of number names makes it a lot easier for us to identify which vertebrae we're talking about. So like, for example, let's say somebody has a herniated disc or they have a problem. And let's say the herniated disc is right here, right? And this is where that pad of cartilage right there has bulged and it's maybe pushing on the spinal cord or pushing on a nerve and it's causing a lot of pain. A doctor, when they do an MRI, they would say, oh, okay, this patient has a herniated disc between L2 and L3. So the fact that we give these number names makes it a lot easier for us to identify the vertebrae. Okay. Now, we also have a curvature here, a normal curve. Now, notice if you're looking at this image on the left, that curve, it's nice and straight. There is no curve. That's because we are looking at the vertebrae from the front. Now, if somebody turns to the side and we look at it from the side, there is a curve, and this is a normal curve. So we find typically that it will be concave, meaning it's sort of pushing in the cervical and the lumbar region. And it's convex, pushing out in the thoracic and the sacral region. So that is a very normal spinal curvature. But we also have some abnormal curvatures, right? So one of them is scoliosis. Scoliosis is an abnormal lateral curve. And so that means if you are looking at someone from the front, instead of the vertebrae being nice and straight, they'll curve to the side. So they'll have a lateral curve to them. Let me show you a picture. So the image here on the right, those two images on the right, so this one and this one, this is scoliosis, an abnormal lateral curve. So you're looking at the patient, in this case, we're looking at them from behind. And you can see that instead of being straight, the vertebral column does that. So it has an abnormal lateral curve. You can see when the patient bends over, you can see there's an abnormal lateral curve, which also is typically accompanied with abnormalities of the rib cage. And you can see that here really well. So the treatment for scoliosis, typically, they cut the patient down the back. They will straighten out the vertebrae as much as they can without damaging the spinal cord or causing any nerves to be pinched. And they will place long rods down both sides of the vertebrae and screw them in place. They oftentimes will also have to break ribs to allow those ribs to move and form in a better shape. Okay. Now, sometimes if scoliosis isn't terrible, sometimes you might be able to have a back brace and wear a back brace, especially if they catch it when you're pretty young. And as you're growing, your bones, when you're young, your bones are really soft. Remember, we talked about that last week. Bones don't have a lot of calcium in them when you're young, and so they're much softer, so it's a lot easier to manipulate them in a child. So back brace might work. You all might remember, I remember in gym class and PE, we always had to have a scoliosis check where we would have to bend over and then the nurse would follow our vertebrae with her finger. Right? Now they do it at the pediatrician. I just went back because we have two other abnormalities and images there. So one is called kyphosis. Kyphosis is a hunchback. So it basically is an exaggerated thoracic curve. So the thoracic curve is normally convex, and it's usually more exaggerated, so it causes you to be sort of hunched over. So here's a great example of that, this image on the left, right? So this one is kyphosis. So you can see how exaggerated that convex curve is, right? It's even more. We find this typically in elderly individuals, right? As the muscles degenerate, as you lose your strength, that's really easy for that to happen. And then the last one is lordosis. This is swayback. So this is an exaggerated lumbar curve. So it's an exaggerated concave curve. So here you can see a little girl with lordosis, right? So this is in the lumbar region. This is also very common in pregnant women. If you think about it, you're carrying this big baby, all this extra weight in front of you. And so it's not uncommon for pregnant women, especially in that last trimester, to develop lordosis. Once they have their baby, it goes away, but that is super common. Now, I mentioned this just a little bit about the vertebrae, is that in between those 26 vertebrae, you do have cushions. You have intervertebral discs. That name makes sense. Inter means between. So these are discs between the vertebrae. I want to talk briefly about what that disc looks like. It is made of cartilage, fibrocartilage, which is a really tough cartilage. We have it between our vertebrae in the intervertebral discs. We also have fibrocartilage in our knee joint, in the meniscus of the knee. And so this image right here on the right, this is showing you looking down on a vertebrae, and you can see the disc right here, that gray disc. Now the disc has two parts to it. It has this tough part around the outside, okay? And that tough part has a little lighter gray color to it. That tough part is called the annulus fibrosus. Okay. And then on the inside, where it's a little darker gray, there's a more gelatinous type material called the nucleus pulposus. I don't know why that connects. And so you can see down here the annulus fibrosus and the nucleus pulposus. So the way I think about this disc, y'all know Gushers candy? I don't know, do they make that anymore? I don't know. It's like the gummy candy that has like liquid on the inside. Grosses me out. But that's the way I think about these discs. So the outside is a little more tough, and then the inside is more jelly-like. Okay. And so the way I remember the names of these is I think of the inside as the nucleus pulposus. So think of those two words, nucleus, nucleus of a cell. It's right in the middle. It's on the inside. Pulposus, I remember pulp, like orange juice pulp, right? It comes from the inside of the orange. So nucleus pulposus, two things coming from the inside. And then the annulus fibrosus is around the outside. So what happens oftentimes is as people age, the discs become less strong. They start to degenerate. And as you age, it is not uncommon for the disc to fail, for that tough outside part to get weaker, and it fails and it ruptures, and the squishy inside part starts to bulge out. We call this a herniated disc. And so you can see that right here. Okay? You can see where that tough outside part has thinned down a lot, and the inside part is squeezing out right there. Think about all the pressure that's on your back and on those discs. So if it has a weak point, it's going to start to squeeze out. Unfortunately, these weak points where they squeeze out, oftentimes they're going to squeeze and pinch a nerve. Like in this case, you can see it's pinching that spinal nerve. Sometimes they'll squeeze out and pinch right in the middle where that spinal cord is. And sometimes they'll pinch on the other side, the other nerve. Depending on where a disc is herniated will determine the pain that you're having. So like, for example, if somebody has a herniated disc in the cervical region, okay, if you herniate it up here in the neck, the nerves that come off in the cervical region, typically they're going to supply the neck and the arms. So if it's pinching one of the nerves, let's say it's pinching a nerve on the right-hand side, you're either going to feel it on the right side of your neck or you're going to feel it down into your arms and your fingers. And a lot of times it'll feel like numbness and tingling. It might feel like a burning sensation. Um, it might be sharpshooting pain. It just depends on the person. And so a lot of times it'll be on the right side if it's pinching the nerves on the right, or it'll be on the left side if it's pinching the nerves on the left. If it's pinching right on the spinal cord, you will have what's called bilateral pain. It'll be on both sides. Now that's in the cervical region. If it's down in the lumbar region, the lumbar nerves are going to supply the legs. So your pain's not going to be up in the arms. If it's herniated down in the lumbar region of your back, then you're going to have pain in the legs. Okay, it'll be the same thing. It'll be either on the right leg, the left leg, or bilateral, depending on where that herniation lies. Okay. Now, I told you that a lot of times as we age, our discs get older, they start to degenerate. It's a condition called degenerative disc disease, and that can lead to herniation, but also lifting things the wrong way. So people that are otherwise super healthy, if you lift something with your back, you know, they say don't lift with your back, lift with your legs. If you lift with your back, you're putting so much stress and pressure on your back that you can easily herniate and rupture a disc. Now the image on the left over here, this is actually showing you an MRI of a herniated disc. So you can see that disc is squeezing out. You can see that bright white line, that is the spinal cord. So you can see it's pinching that spinal cord. Again, this is in the lower back. You can tell because this right here is the sacrum. And so you know the pain for this individual is going to be in the legs. Okay. Now I want to walk you through, when we look at our vertebrae, let's talk a little bit about the parts and pieces on our vertebrae. So we have the body of the vertebrae, which is this part right here. So we are looking at a vertebrae kind of down on the vertebrae. The body of the vertebrae, you can see it's a big chunk of bone. So this is really going to bear the weight, and actually this is what the disc will sit on, right? So it's going to sit on top of that body. If you go back, you can see where that disc is sitting, that gray disc, right on the body of the vertebrae. So this is where the weight is going to be bared. The vertebral foramina. So the word foramen, you're going to see this a lot this week. It means hole. If we change that word foramen and turn it into foramina, that's whole, it's just plural, okay? It's just holes. And so the vertebral foramen, you can only see one of them right here, is the hole right here, and it allows the spinal cord to pass through. So all the vertebrae stacked together, all those holes together would be the vertebral foramina. Now the spinous process is right here. Now if you feel your back, right, if you just kind of feel your back, sometimes we say we're feeling our spine. Well, you're not really feeling your spine, but you are feeling your spinous processes. So all those little bumps that you can feel on your back, those are those processes sticking out. We also have some that stick off to the sides called the transverse process. On your bones, anytime you have a big projection sticking off, like the spinous process or the transverse process, it is there either because it's forming a joint or because you've got big muscles connecting there. And in this case, you've got big back muscles connecting to the spinous processes and to the transverse processes. You also have a superior and an inferior articular process. So the term articular or articulation, again, remember it means joint. Whoops. So a superior articular process is going to form a joint with the vertebrae above it. So we can see in this image right here, a process is just anything that sticks off the bone, any projection. So that articular process on this vertebrae that you can see here is just forming a joint with the vertebrae above it. Now in this image, you can't see the inferior articular process. It would be on the underside, forming a joint with the vertebrae below it. And then lastly are the intervertebral foramina. Now remember, you know what this term means. It means holes. And in this case, notice it's not vertebral foramina, but intervertebral foramina. That prefix inter means between. So I'm going to flip back to this picture so you can see these. Intervertebral foramina are holes between the vertebrae. And the only way you see them is if you look at the vertebral column from the side. And now you can see all these holes between the vertebrae. These allow all the spinal nerves to pass through. Okay. Now we also have, remember, the sacrum at the bottom. The sacrum is vertebrae that have been fused together. This is going to articulate with the last lumbar vertebrae above it. So it's forming a joint with that last lumbar L5 above it. And it's also going to articulate with your hip bones on the sides. And I'll show you a picture of that. Let's see. No, I'm not. Yes, I will. Hold on. It's going to take me a minute to get there. It's not the best picture. But you can see the hip bones here. And then here is the sacrum. You're kind of looking at this like if you're a gynecologist, like looking up that way. And you can see right here where the sacrum is connecting to those hip bones. Okay. And again, we're going to look at all of these again on Wednesday as we go over some of these. Oops. Some of the major markings on the sacrum that you're going to look at this week are the sacral foramina. Again, you know that term means holes. So these are all the little holes in the sacrum. So you can see all those right here. Okay. Again, the holes are there because they're allowing blood vessels or nerves to pass. They are a passageway. The transverse lines of fusion or transverse lines of fission, these are basically where the vertebrae have fused together. Again, your sacrum is about 5 vertebrae that have fused together. And so we can see those right here. So where all those body of the vertebrae have fused together. And then the sacral hiatus, this is basically the portion of the last sacral vertebrae that is not fused together. So you can see that right here. So it's sort of this opening down at the very bottom of the sacrum. Now the tailbone, or the coccyx, this is about 4 vertebrae that have fused together, and it is very small. This one, I'm going to write this off to the side. This one is a vestigial structure. I know I've used this term in the past when we talked about erector pili muscles. A vestigial structure is a remnant. It is something that we have in our bodies that's left over from our ancestors. It's not anything that we use today. It's just a leftover structure. We do not have tails, right? But we have a tailbone. We have a coccyx. So at some point, our ancestors probably had tails. And so this is just what's left over. It's a vestigial structure, provides us no function, okay? And you can see that coccyx right here. All right, so the last part of our axial skeleton is our bony thorax. The bony thorax is basically the thoracic cage. It's the ribs and the sternum. And in the back, it is the thoracic vertebrae. So I want you to think about this. So remember your vertebrae and the number of vertebrae. Remember you have 7 cervical, 12 thoracic, 5 lumbar. You have 12 thoracic vertebrae. You also have 12 ribs, okay? All 12 of those ribs connect in the back to your 12 thoracic vertebrae. So in the back, you have thoracic vertebrae. Around the sides, you have ribs. And in the front, you have your sternum. Now, the functions of your bony thorax is protection. This is a super protective area for all those vital organs up there, like the heart and the lungs. Also, it is a great place for your shoulders to connect. So your shoulder joints, like your shoulder and, sorry, your scapula and your clavicle, these are going to connect onto that bony thorax. It's also a great place for a lot of neck and back muscle attachment. You have muscles between your ribs that allow your ribs to move when you breathe. If you, and we actually do this in anatomy too, when we do the respiratory system. If you were to take a tape measure and measure around your thorax, when you blow out, your thorax is going to be smaller. And if you take a big breath in, your thorax gets bigger. It does that because your ribs actually pivot up a little bit. When they pivot up, it allows that space to get bigger and your lungs can fill with oxygen. Now the sternum is the bone in the front. It is sort of a dagger-shaped bone. There are 3 bones in your sternum. The first is called the manubrium. Just under that is the body. And last is the xiphoid process. So I'll show you a picture of these. It's not the best picture, but it's part of one. We can see we're looking at the sternum. So we have a manubrium at the top. We have a body here. And then at the bottom, you can't see it. It's a little dagger-shaped bone called the xiphoid process. Okay, so those are the 3 parts of your sternum in the front. Now again, we do have our ribs. We have 12 pairs of ribs, match those 12 thoracic vertebrae. The ribs, we actually divide our ribs up into what's called true ribs. These are ribs 1 through 7. You start counting at the top. So 1 through 7 are true ribs, and the reason is because they have direct connections to the sternum up front. So they have cartilage that connects them to the sternum. Just under that, ribs 8, 9, and 10 are false ribs. These are false because they have cartilage connecting them to the sternum, but the cartilage sort of combines together before it connects to the sternum. So it's an indirect connection. And then lastly are our floating ribs. And floating ribs have no connection to the sternum. They're just kind of floating in there. So let me show you a picture. You can see here our true ribs really well. So you can see that rib coming in, and then you can see it directly connecting with cartilage. Okay, we can't see our false or our floating ribs from this image, but you can see the true ribs.